Lee Health clinical psychologist Rebecca Kirkwood works closely with victims of traumatic brain injuries.
There's some sort of accident or assault or actual projectile that hits the head and causes a skull fracture or causes the brain to accelerate and decelerate inside the skull.
Symptoms can include confusion, blurry vision, and difficulty concentrating. They can also change someone's personality.
Sometimes when people have an injury to the frontal part of their brain, they lack those brakes or lack a filter, and they may end up blurting out something.
If the injury affects the right hemisphere of the brain,
that person can then seem very disinterested. They can almost seem depressed, but they're not necessarily depressed. They're just very removed, and they're very just shut down.
Lee Health offers rehab for traumatic brain injury victims. The goal is to get them to the highest function as possible.
The person is evaluated when they come in, and they are seen by a physical therapist, an occupational therapist, a speech therapist.
Lee Health also has support groups for victims and their families.
It's primarily to help both the patient and family to cope and deal with changes and to provide support for one another.
The free support groups meet the fourth Wednesday of every month. You can email tara.howe@leehealth.org if you're interested in participating. For Lee Health, I'm Devin Turk.